This is the Medical Terms Project by Paulette Lee. My last name changed, so it's also Akers. So the first thing I chose was cervical cancer, and it is a disease. It's a malignant tumor of the cervix, which progresses from cervical dysplasia to carcinoma. The cause is linked to the HPV infection. Malignant means that it tends to become progressively worse, and it causes death. Dysplasia is an abnormal development. Carcinoma is a situ cancer in the early stage before invading surrounding tissue. It is not made up from word parts. So word parts may be present in the term, however the full meaning cannot be translated using definitions of word parts alone. So instead of just repeating that definition over and over again, I'm just going to say it's made from word parts, or not made from word parts. So the treatment for it depends on the stage. Teletherapy is a radiation therapy that uses X-rays or other high-energy beams to destroy cancer cells and shrink tumors. Brachytherapy is when you place radioactive material inside the body to treat the cancer. A loop electrosurgical excision procedure is when you use a wire loop heated by electric current to remove abnormal cells and tissue in the cervix and the vagina. Radiation therapy is a treatment that uses X-rays and other high-energy rays to kill abnormal cells. Cervical conization is a surgical removal of a cone-shaped tissue sample from the cervix. It's also known as a cone biopsy. Cervical cancer continued. A Pap smear, also known as Pap test, is a procedure to test for cervical cancer in women. It's a preventive procedure. A Pap smear involves collecting cells from your cervix. It's to detect cervical cancer early with a Pap smear. It gives you a greater chance at a cure. Some specialists that are associated with this disease are first be an OBGYN, which is a doctor that focuses on reproductive health in women and childbirth. An oncologist, it specializes in cancer. A radiation oncologist treats and manages cancer by prescribing radiation therapy. Then your PCP, which is a primary care provider, prevents diagnosis and treats diseases. So on the left is a picture of a Pap smear actually happening. You'll see that the little box right there is the cervix, and then the little brush right there is brushing it. It brushes in a cervical motion. Ignore that. So it shows the speculum being inserted into the vagina and where it brushes on the cervix. It also shows the top of the uterus right there. And then you look on the bottom, there's your rectum. On the right side is stage IA1 and IA2 cervical cancer, and it shows where the vagina is located, where the cervix is located, and then the measurements of the cancerous cells itself. Hold on. So the next one is a myocarditis. It is broken down to my or myo, to cardi, cardio, and it. It is a muscle heart inflammation when it is broken down. So myocarditis is an inflammation of the muscle of the heart or the heart wall. It is a medical condition, so it's not a disease, it's a condition. The myocarditis is usually caused by a viral infection. A severe case can weaken the heart, which can lead to heart failure, abnormal heartbeat, and sudden death. So not good. Some of the symptoms include chest pain, abnormal heartbeat, and shortness of breath. Treatment may include medication to regulate the heartbeat and improve the heart function, but it can be self-healing and it usually heals over time. In rare but severe cases, a device may be needed to help the heart function. So some of the specialists associated with this medical condition is a cardiologist, which specializes in heart disorders, a cardiothoracic surgeon, surgically treats diseases affecting organs inside the chest, a pediatrician if it happens to happen to children or teenagers. A pediatrician provides medical care for infants, children, and teenagers. A PCP primary care provider, which we saw on the last slide, prevents, diagnoses, and treats diseases. So on the left, there is a picture for comparison. So on the left of the picture is a healthy heart with a nice thin wall. And then on the right is an inflamed wall where you can see that there's a bunch of space where there shouldn't be. So it's inflamed along the right side and then a little bit on the bottom. So the tests that diagnose myocarditis include a blood test and a chest x-ray. So the blood test studies to detect enzymes that leak into the blood when the heart has been damaged and to detect infection and antibodies. Chest x-ray is a radiograph or a picture of the heart and lungs, including blood vessels, ribs, and bones of the spine. So the next one is volvulus. So volvulus is a medical condition and is not built alone from word parts. It is a medical condition that needs emergency surgery to repair and remove possible dead tissue. So the 5 possible surgeries are laparotomy, which is a surgical opening made in the abdomen to diagnose or treat various diseases. Colostomy, which is a surgical creation of an abdominal opening where stool can leave the body. A laparoscopic surgery that uses a video camera and thin tubes inserted into small cuts on the body to repair or remove tissue. A colossotomy, which is a surgical removal of all or part of the colon. A bowel resection, which is a surgical removal of part of the intestine. So in the picture on the left is 2 large intestines, otherwise known as a colon. And you can see on the left that it's perfect, there's no kinks in it, and it loops around nicely. And if you look on the right side of the picture, the loop of the intestine twists around itself, so that's what it is. You can see that it's red and inflamed, and it's quite large where it shouldn't be. So in the next slide, this is just it continued. So some of the specialists are a general surgeon, a pediatric surgeon, emergency medical doctor, a gastroenterologist, and a neonatologist. So the first one performs a range of surgeries on the abdomen, skin, breast, and soft tissue. A pediatric surgeon provides medical care for infants, children, and children. And I said that twice, and I should have said children and teenagers. The next one is emergency medical doctor, treats patients in the emergency department. The next one is a gastroenterologist, which focuses on the digestive system and its disorders. The next one is a neonatologist, which provides care to newborn infants. The diagnosis is typically with medical imaging, such as a plain X-ray, a GI series, or a CT scan. Initial treatment for sigmoid volvulus may occasionally occur via sigmoidoscopy or with a barium enema. Due to the high risk of recurrence, a bowel resection within the next 2 days is generally recommended. So I threw in just, a CT scan, X-ray, or not a CT scan, pardon me, an X-ray of what it kind of looks like. So here in the bottom, you see that kind of big shape that's kind of looks like a coffee bean. That is the intestine that is twisted and enlarged. So the next one is Addison disease. So Addison disease is a chronic syndrome resulting from a deficiency in the harmonica secretion of the adrenal cortex. Some of the signs and symptoms may include weakness, weight loss, hypertension, darkening of the skin, and loss of appetite. Addison's disease was named in 1855 for Thomas Addison, who was an English physician and pathologist. He described the disease as a morbid state with feeble heart action, anemia, irritability of the stomach, and peculiar change in the color of the skin. So how do you diagnose the Addison disease, you may ask? Blood test. Blood tests can measure your blood levels of sodium, potassium, cortisol, and ACTH, because I cannot say that. It's a hormone which stimulates the adrenal cortex to produce its hormones. A blood test can also measure antibodies associated with autoimmune Addison's disease. ACTH stimulation test is what it's called. So here in the bottom right corner, I just put a picture of blood vials to kind of signify that it's a blood test. So some of the specialists are a endocrinologist, which treats metabolic and hormone disorders, and the next is a PCP, prevents, diagnoses, and treats diseases, primary care provider. The name is not completely from word parts. The next one, and my last slide, I believe, is obstructive sleep apnea, which is shortened to OSA. Obstructive sleep apnea is seen in all age groups, but the frequency increases with age and obesity. So, weight loss, sleeping on one side, and decreasing alcohol consumption can help treat this. The delivery of pressure via a face or nasal mask, a CPAP, is often prescribed. Other common treatments may include an oral device and surgery. Some of the symptoms are sleep, respiratory, behavioral, cognitive, urinary. So excessive daytime sleepiness, snoring, gasping during sleep, or insomnia. Episodes of no breathing, breathing through the mouth, loud breathing, or shortness of breath. Hyperactivity or irritability. Cognitive lack of concentration or memory loss. Urinary, bedwetting or excessive urination at night. Also common are fatigue, depression, dry mouth, headache, reduced sex drive, sore throat, and teeth grinding. So here in the next slide, if you look along the right side of it, the top left of the pictures is a tricked out sleep mask. It is an alien that is latched onto him. The next one over is a little nose device. It's also a sleep mask, but it is a little more compact. But the basic thing is it opens up your airways, so the air gets into your body easier. Bottom left is the actual machine itself and a normal sleep mask. And then the right side on the bottom is just a CPAP machine mask, actually shown how it fits onto your face and what its purpose is, kind of thing. So you can see the airflow going up the tube and into your nose. So you could see where the lower jaw is located. So it kind of latches on it right above your nose, at the top by your temple, and then under your chin. So it shows here the lower jaw, and then the attachment of tongue to the lower jaw, the tongue, the hard palate, and the soft palate. And you could see that it's opening up the airways down there. Okay, so the treatments are, like we said before, weight loss, sleeping on one side, decreasing alcohol consumption can help. Delivery of pressure via face or nasal mask. It is often prescribed. Other common treatments include an oral device and surgery. And after that is just a bunch of stuff that I've cited. Most of it I have listed by specific slide, and then there's a couple over here that are continued, where I just kind of listed in an order. And some of it's from the book, some of it's from online, of places that I found. I listed just kind of little notes that I had because it was a little challenging to get all this done. So thank you for watching and listening to me talk. I'm going to go ahead and escape from that now. Have a wonderful day, and thank you for looking into my slide.